Good morning everyone. It's me Sanju Pandit. Welcome back to channel Medical with Sanju. I hope you all are fine. Today we are going to discuss about solution of Nepal Nursing Council based model exam set 18. Question number 1. Antibody is produced by option A protein, option B plasma, option C antigen and option D lymphocyte. एन्टिबडीलाई इम्युनोग्लोबिन पनि भनिन्छ। यो एक किसिमको प्रोटिन हो र यसलाई चाहिँ प्लाज्माले प्रोड्युस गर्छ। यो वाइ शेपको हुन्छ। यसले हाम्रो बडीमा इन्फेक्सन्सबाट बचाउँछ। इट प्रोटेक्ट बडी फ्रम भेरियस इन्फेक्सन। ऑप्शन बी इज राइट आन्सर। क्वेश्चन नंबर 2. Which of the following nerves is responsible for hearing and balance? Option A vagus nerve, option B Vestibulocochlear nerve, option C Glossopharyngeal nerve and option D olfactory nerve. Hearing and balance दुईटैको काम गर्छ भेस्टिबुलोकोक्लियर नर्भ। ऑप्शन बी इज राइट आन्सर। भेस्टिबुलोकोक्लियर नर्भ दुईवटा कम्पोनेन्टबाट बनेको छ। एउटा भेस्टिबुलर नर्भ, अर्को कोक्लियर नर्भ। Vestibular nerve is responsible for balance and equilibrium, and cochlear nerve is responsible for hearing. Cochlear nerve ले hearing and vestibular nerve ले balance. Question number 3. What is the first sign of puberty in female? Option A thelarche, option B menarche, option C pubarche and option D adrenarche. The first sign of puberty in female is thelarche. Option A is right answer. It is the first physical development of the female start with a thelarche, means breast development, and last sign huncha menarche. That means first menstruation cycle. First menstruation cycle लाई menarche र breast development लाई thelarche भनिन्छ। Question number 4. The most important electrolyte of intracellular fluid is option A sodium, option B calcium, option C potassium and option D chloride. The most important electrolyte of intracellular fluid is potassium. Option C is right answer. And intracellular fluid huncha sodium. Question number 5. Which of the following is the side effect of theophylline? Option A hypotension, option B bradycardia, option C oliguria and option D hypertension. Side effect of theophylline huncha cardiovascular, hypotension, headache, tachycardia, irritability, nausea, vomiting, increased urination यो जस्ता सिम्पटम्सहरु थियोफाइलिनमा पर्छ है। यहाँ के सोधेको छ व्हिच अफ द फलोइङ द साइड इफेक्ट अफ थियोफाइलिन यो सबैमध्ये हाइपोटेन्सन चाहिँ आउँछ। ऑप्शन ए इज राइट आन्सर। क्वेशन नंबर 6. व्हिच अफ द फलोइङ क्यारी जेनेटिक मटेरियल इन अ लिभिङ अर्गानिज्म? ऑप्शन ए आरएनए, ऑप्शन बी राइबोसोम, ऑप्शन सी डीएनए एन्ड ऑप्शन डी लाइसोसोम। The right answer is option C, DNA. DNA is the genetic material in all living organisms and it is responsible for the transmission of hereditary character. RNA controls the synthesis of protein. Question number 7. Which of the following is the powerhouse of cell? Option A mitochondria, option B nucleus, option C cytoplasm and option D Golgi apparatus. Option A mitochondria is a right answer. Mitochondria is also known as powerhouse of cell. Question number 8. The beta cell of islets of Langerhans secrete. Option A insulin, option B somatostatin, option C and option D enzyme. The right answer is option A, insulin. यो सबै पेनक्रियाजको हर्मोन हो। तीनवटा हुन्छ, अल्फा सेल, बीटा सेल एन्ड डेल्टा सेल। अल्फा सेलले ग्लुकागन सेक्रेट गर्छ। इट इन्क्रिज द ब्लड ग्लुकोज लेभल। बीटा सेलले इन्सुलिन सेक्रेट गर्छ। इट डिक्रिज द ब्लड लेभल, ब्लड सुगर लेभल। यसले मेन्टेन गरेर राख्छ सुगर लेभललाई। एन्ड डेल्टा सेल सोमेटोस्ट्याटिन सेक्रेट गर्छ एन्ड इट मेन्टेन द फंक्शन अफ अल्फा एन्ड बीटा सेल। क्वेश्चन नम्बर 9, इन मेल muscle is greater and stronger than female due to option A, estrogen, option B, progesterone, option C, androgen and option D, prolactin। कुन हर्मोनले गर्दा फिमेल भन्दा बडी स्ट्रङ चाहिँ मसल हुन्छ मेलको? The right answer is option D, androgen ले गर्दा चाहिँ। The major androgen in a male is testosterone। टेस्टोस्टेरोन हर्मोनले गर्दा चाहिँ भएको हुन्छ। क्वेश्चन नम्बर 10, प्रेजेन्टेसन अफ इलेक्ट्रिकल एक्टिभिटी अफ हार्ट इज ऑप्शन ए, डिफाइब्रिलेसन, ऑप्शन बी, इलेक्ट्रोकार्डियोग्राम, ऑप्शन सी, इकोकार्डियोग्राम एंड ऑप्शन डी, ऑल ऑफ देम। The right answer is option B, electrocardiogram। Question number 11, apical sound is heard at option A, second and third intercostal space at the left mid-clavicular line, option B, second and third intercostal space at the right mid-clavicular line, option C, fourth and fifth intercostal space at left mid-clavicular line, and option D, fourth and fifth intercostal space at right mid-clavicular line। The right answer is option C, fourth and fifth intercostal space at left mid-clavicular line। mid-clavicular line मा एपिकल पल्स चाहिँ राम्रोसँग सुनिन्छ स्टेथोस्कोपको सहयोगले। यसमा पनि सबभन्दा बढी र क्लियर साउन्ड भनेको माइट्रल भल्भमा सुनिन्छ। क्वेशन नम्बर 12, anorexia means option A, loss of appetite, option B, loss of sleep, option C, loss of smell and option D, loss of hearing and balance। The right answer is option A, anorexia means loss of appetite। loss of sleep लाई insomnia भनिन्छ, loss of smell लाई anosmia भनिन्छ and loss of hearing and balance लाई anorexia भनिन्छ। Question number 13, insulin is given option A, intramuscular, option B, intradermal, option C, subcutaneous and option D, intraosseous। insulin subcutaneous route-बाट दिन्छ, option C is right answer। Question number 14, which of the following is the best method in assessing for a correct placement of NG tube? Option A, chest X-ray, option B, immune tube of a tube in water to check for a bubble produced, option C, aspirating gastric content to check if content is acidic, option D, instilling air in NG tube and listening for a gargling sound at epigastric area। The right answer is option A, chest X-ray बाट confirm हुन्छ placement of NG tube। Question number 15, physicians prescribe a drug to be given as the nurse administers the drug, option A, once a day, option B, at bedtime, option C, before meal and option D, immediately। HS means at bedtime, option B is right answer। AC means हुन्छ before meal, PC after meal, OD once a day, BD twice a day, TDS thrice a day, QID 4 times a day, PR and as per required, and PO meal per orally, HS at bedtime, SOS if necessary। यो चाहिँ एब्रिभिएसन हो मेडिसिन कसरी कुन टाइममा दिने भने। क्वेश्चन नम्बर 16, what is the antidote of opioid poisoning? Option A atropine, option B magnesium sulfate, option C naloxone, and option D Pascal's law. The right answer is option C naloxone. The antidote of opioid poisoning is naloxone. Option C. वारफेरिन को एन्टिडोट हुन्छ भिटामिन के। इम्पोर्टेन्ट भन्दैछु। वारफेरिन को एन्टिडोट हुन्छ भिटामिन के। हेपारिन को एन्टिडोट हुन्छ प्रोटामाइन सल्फेट। एट्रोपिन को पनि एन्टिडोट हुन्छ फिसोस्टिग्माइन। पारासिटामोल को एन्टिडोट हुन्छ एन एसिटाइल सिस्टिन। organofosphorus को एन्टिडोट हुन्छ एट्रोपिन। डिजिटालिस को एन्टिडोट हुन्छ म्याग्नेशियम सल्फेट। लीड एन्ड अदर हेभी मेटल्सहरुको एन्टिडोट हुन्छ ग्यास्ट्रिक लाभाज। यो इम्पोर्टेन्ट एन्टिडोट हो जुन चाहिँ एक्जाममा सोधिराखेको हुन्छ। क्वेशन नम्बर 17, डिस्पारेटरी operates on option A Bowell's law, option B Newton law of gravity, option C Pascal law, option D Archimedes principle. The right answer is option A. Respiratory operates on a Bowell's law. Respiratory operate Bowell's law ले गर्छ। Option D मा दिएको छ Archimedes principle. युरोमिटरमा चाहिँ यो प्रिन्सिपल लागू हुन्छ। बोयल्स लमा मेकानिजम अफ रेस्पिरेटरी ऑपरेट गरिन्छ। त्यस्तै पास्कल्स लमा ब्लड प्रेशर। न्यूटन्स लॉ अफ ग्राभिटीमा फोलिक कैथेटराइजेशन्स यूरिन फ्लो यसरी चाहिँ डिफरेंट प्रिन्सिपल्स द्वारा चाहिँ यसरी ऑपरेट भएको हुन्छ। क्वेशन नंबर 18, ब्लेड्स नाइफ सीजर्स इंस्ट्रूमेंट आर बेस्ट स्टेरिलाइज्ड बाय ऑप्शन ए autoclave, ऑप्शन बी हॉट एयर ओवन, ऑप्शन सी केमिकल एंड ऑप्शन डी गैस स्टेरिलाइजेशन। ब्लेड नाइफ एंड सीजरलाई हट एयर ओभनबाट स्टेरिलाइज गरिन्छ। ऑप्शन बी इज राइट आंसर। क्वेश्चन नंबर 19, हॉस्पिटल एक्वायर्ड इन्फेक्शन इज कॉल्ड ऑप्शन ए नोजोकोमियल इन्फेक्शन, ऑप्शन बी opportunistic infection, option C exogenous infection, and option D viral infection. The right answer is option A. Hospital acquired infection is called nosocomial infection. Health portion include infection is known as a iatrogenic infection, and opportunistic infection means हुन्छ इन्फेक्शन इन इम्युनोकम्प्रोमाइज्ड पेशेन्ट। इम्युनिटी कम भएको पेशेन्टलाई लाग्छ कुनै इन्फेक्शन भनेको अपर्चुनिस्टिक इन्फेक्शन हुन्छ र हेल्थ पर्सन्सबाट जस्तै कि डाक्टर अथवा नर्सको रिजनले कुनै इन्फेक्शन लाग्यो भने त्यसलाई आइट्रोजेनिक इन्फेक्शन भनिन्छ। क्वेशन नंबर 20, ट्रान्सफर्स अफ हीट फ्रम वन ऑब्जेक्ट टू अनदर ऑब्जेक्ट विथ डाइरेक्ट कॉन्टैक्ट इज कॉल्ड ऑप्शन ए कंडक्शन, ऑप्शन बी कन्वेक्शन, option C radiation, and option D evaporation. Right answer is option A is called conduction. Conduction means the process of transferring of heat from one object to another object by direct contact. Convection means the process of heat transmission through the currents of a moving liquid or gases. Evaporation means the transfer of heat through conversions of water to vapor or transfers of heat when a liquid changes to gas. And radiation means the process of heat transmission from one to another without help of any media. Question number 21. Consent is given by patient before operation. It is called option A autonomy, option B beneficence, option C non-maleficence, and option D justice. इथिकल प्रिन्सिपलमा यो पोइन्टहरु पर्छ autonomy, beneficence, non-maleficence, justice, and veracity. Autonomy means respecting the right of others to make their own decisions. Beneficence means to do good. Non-maleficence means doing no wrong to a patient. Justice means fairness and equality. Veracity means trustfulness. यहाँ इसको आंसर हुन्छ ऑप्शन ए इज autonomy. Question number 22. For which complication you closely observe after endoscopy of gastrointestinal system? Option A rectal bleeding, option B throat pain, option C loss of gag reflex, and option D headache. Loss of gag reflex, option C is right answer. Question number 23. Collections of air inside thoracic cavity or pleura is called. Option A pneumothorax, option B hemothorax, option C emphysema, and option D pleural effusion. The right answer is option A pneumothorax. Pneumothorax means collection of air in pleural space. Hemothorax, collection of blood in pleural space. Emphysema means abnormal permanent enlargement of air space. And pleural effusion means abnormal collection of fluid in a pleural space. Question number 24. While transferring patient with chest tube drainage, nurse should option A clamp the tube, option B keep the tube on clamp, option C disconnect the tube, and option D all of above. The right answer is option B. Keep the tube on clamp. While transferring patient, chest tube drainage should not be clamped because clamping prevents escape of air fluid, increasing the risk of tension. र ड्रेनेज च्याम्बर जहिले पनि पेशेन्टको चेस्ट लेभल भन्दा तल राख्नुपर्छ. Question number 25. Which route of administration is used for an antibiotic sensitivity test? Option A intramuscular, option B intradermal, option C subcutaneous, and option D intravenous. Antibody sensitivity testing should be done before giving any antibiotic. किनभने यो दिनुभन्दा अगाडि कुनै किसिमको एलर्जी छ कि छैन भने चाहिँ पहिला आइडेन्टिफाई गर्नुपर्छ. र एन्टिबायोटिक सेन्सिटिभिटी टेस्टिङ इज शुड बी गिभन इन्ट्राडर्मल रुटबाट गरिन्छ. अप्सन बी इज राइट आन्सर. इन व्हिच पोजिसन शुड नर्स प्लेस अ पेशेन्ट फर urinary catheterization? Option A supine, option B prone, option C lateral, and option D dorsal recumbent position. Dorsal recumbent position maintain गर्नुपर्छ. Option D is right answer. It provides good visualizations of meters and is comfortable for a patient also. Question number 27. A physician prescribes 400 mg megapain. A nurse has 1 gram dissolved in 5 ml distilled water. How much would the nurse administer? Option A 5 ml, option B 2 ml, option C 3 ml, and option D 4 ml. यसको चाहिँ मैथमेटिक तरिकाबाट निकाल्नु पर्छ. यसको फर्मुला हुन्छ डोज अर्डर बाई डोज अवेलेबल इन्टु क्वान्टिटी इन ह्यान्ड. जस्तै यहाँ अर्डर दिएको डोज छ 400 र आफूसँग छ 1 ग्राम मिन्स 1000 mg. 1 ग्राम इज इक्वल टु 1000 mg हुन्छ. एउटै युनिटमा चाहिँ लेख्नुपर्छ इन्टु 5 ml इज इक्वल टु 2 ml आउँछ. अप्सन बी इज राइट आन्सर. क्वेसन नम्बर 28. टेंडल बर्ड्स पोजिसन मिन्स ऑप्शन ए एलिवेशन of foot of bed of 50 to 30 degree, option B elevation of head of bed at 15 to 30 degree, option C sitting positions with the head elevations at 45 degree, and option D elevations of bed at 90 degree. Option A is right answer. Elevation of foot of bed at 50 to 30 डिग्री र टेन्डर पोजिसन सक पोजिसनमा मेन्टेन गरिन्छ। क्वेशन नम्बर 29 A client comes in emergency ward with a epistaxis. What is the first nursing action? Option A pack the interior part. Option B pack the posterior part. Option C pinch the nostril shunt for 10 to 15 minutes. And option D provide cold compression. The right answer is option C. Pinch the nostril shunt for 10 to 15 minutes. त्यसबाट के हुन्छ ब्लिडिङ रोकिन्छ। क्वेशन नम्बर 30 At what degree the intramuscular injection is given? Option A 45 degree, option B 90 degree, option C 15 degree and option D 30 degree. Intramuscular injection means 90 degree. Option B is right answer. Intramuscular 90 degree मा हुन्छ, subcutaneous 45 degree, intravenous 25 degree, intradermal 10 to 15 degree. Question number 31. Installations of ear drop in children is done by pulling ear. Option A backward and upward, option B backward and downward, option C upward, option D backward. Children मा backward and downward हुन्छ। Option B is right answer. Same condition if adult मा छ भने backward and upward हुन्छ त्यतिखेर। Question number 32. The first steps to be taken for a client with fracture would be option A reassess the client, option B transfers to a health facility, option C use of padding and option D option D. Question number 33. While providing oral care to the unconscious client, the client should be placed on option A prone position, option B sideline position, option C supine position and option D semi-flower position. The right answer is option B sideline positions to prevent aspiration. Question number 34. Doctor prescribes 2000 ml of NNC to be given over 24 hours using an IV set with a drop rate of 50 drops per minute. The nurse should regulate the infusion at option A 10 drops per minute, option B 20 drops per minute, option C 15 drops per minute and option D 21 drops per minute. यो क्वेशन पनि म्याथमेटिक तरिकाबाट सोल्भ गर्नुपर्छ। यसको फर्मुला हुन्छ amount of IV fluid into drop factor by time in minutes. यहाँ amount of IV fluid दिएको छ 2000. So 2000 into drop factor 15 by 24 hours यहाँ दिएको छ। आवरलाई मिनेटमा कन्भर्ट गर्नलाई 60 ले मल्टिप्लाई गर्ने 20.83 drops per minute आउँछ। 8 लाई पॉइंट भन्दा यता 5 भन्दा माथि छ भने 1 जोडिन्छ। So 21 drops per minute. Option D is right answer. Question number 35. The first actions nurse should take if blood transfusion reaction occurred in a patient is option A take vital sign, option B continue blood transfusion, option C stop the transfusion and call doctor, option D show the flow rate of blood. First मा stop गर्नुपर्छ। Option C is right answer. Question number 36. Which of the comfortable device is used to prevent foot drop in a client with a prolonged bedrest? Option A Sandbag, option B Cradles, option C pillow and option D splint. Option D is right answer. Question number 37. When the elevated temperature fluctuates widely but does not reach normal level between fluctuation, it is called option A constant fever, option B remittent fever, option C intermittent fever and option D relapsing fever. The right answer is option B It is a remittent fever. Remittent fever ma temperature fluctuate more than 2 degree Fahrenheit but does not reach normal between the fluctuation. जस्तै example thyroid fever मा हुन्छ. Intermittent fever मा the body temperature rises and falls to normal every day. प्रत्येक दिन के हुन्छ बढ्छ र घट्छ. जस्तै कि मलेरिया केसमा. Crisis means when the body temperature falls suddenly to normal. And lysis means temperature falls generally. Crisis and lysis मा प्राय जसो स्टुडेन्टहरु कन्फ्युज भइराखेको हुन्छ. लो lysis and जोर से crisis means suddenly normal मा आउनु र लो भन्नुको अर्थ बिस्तारै normal तिर आउनु means lysis. And relapsing fever means recurrent episode of fever lasting after a few days. And inverse fever पनि हुन्छ, temperature higher in the morning than in evening. Question number 38. In abdominal examination, what comes after inspection? Option A, palpation. Option B, percussion. Option C, auscultation. And option D, smelling. The right answer is auscultation. Abdominal examination गर्दा first मा inspection, then auscultation, then percussion and last मा palpation गरिन्छ. Because palpation and percussion may stimulate the bowel activity, भनेको result चाहिँ wrong आउन सकिन्छ. So, question number 39. Avoidance of pain in client is option A, physiological needs. Option B, safety and security needs. Option C, love and belonging. Option D, self-esteem. It's a physiological need. Avoidance of pain लाई physiological need मा राखेको छ. Option A is right answer. Physiological needs are very basic needs such as यो चाहिँ food, water, air, oxygen, nutrients, activity, rest, sleep, homeostasis, excretion, avoidance of pain and sex. यो सबै चाहिँ physiological need मा पर्छ. Question number 40. Which of the following is objective data? Option A, micturition. Option B, abdominal pain. Option C, redness in vein open site. And option D, nausea. Subjective data and objective data हुन्छ. Subjective data means information given by patient, his or her relatives to the nurse as in history taking. And objective data means information about the patient obtained by nurse through the observations or physical examinations and various tests बाट. त्यही भएर यसको आन्सर यहाँ हुन्छ अप्सन सी, रेडनेस इन अ भेन. यो के भयो अब्जर्भेसन गरेर डाक्टर अथवा नर्सले चाहिँ आइडेन्टिफाई गर्न सकिन्छ. सो इट इज अ अब्जेक्टिभ डाटा. क्वेशन नम्बर 41. Nepal Nursing Council take license examinations of a nurse to protect. Option A, nurse. Option B, public. Option C, doctor. And option D, all of above. To protect public. Option B is right answer. Question number 42. After the surgical scrub, the nurse should keep her hand. Option A, 45 degree. Option B, 90 degree. Option C, above the elbow. And option D, below the elbow. Option C, above the elbow चाहिँ hand राख्नु पर्छ. Question number 43. Before giving digoxin, the nurse assess heart rate, blood pressure, heart sound, lung sound. Heart sound assess गर्नु पर्छ. Option A is right answer. Question number 44. Which of the following is the best positions for lumbar puncture? Option A, supine position. Option B, side lying. Option C, prone. And option D, flower position. Side lying position maintain गर्नु पर्छ lumbar puncture गर्ने बेलामा. लेफ्ट चाहिँ कमन हुन्छ, लेफ्ट साइड लाइन पोजिसन चाहिँ मेन्टेन गर्नु पर्छ. क्वेशन नम्बर 45. A patient came in emergency ward with a profuse bleeding after cut injury. What is the best action? Option A, compress the bleeding site by bandaging. Option B, dressing at the bleeding site. Option C, wait till the doctor arrives. Option D, apply cold compress. The right answer is option A. Compress चाहिँ गर्नुपर्छ. Compress the bleeding site by bandaging. त्यसबाट के हुन्छ? Blood चाहिँ रोकिन्छ. Question number 46. To observe temperature trends of patient with fever, which chart is used by the nurse? Option A, nursing daily record. Option B, graphic chart. Option C, continuation sheet. And option D, intake and output chart. Graphic chart maintain गर्नुपर्छ. Option B is right answer. Question number 47. Nursing diagnosis contain. Option A, assessment. Option B, patient's problem. Option C, goal. And option D, planning of action. Nursing diagnosis means patient problem. Option B is right answer. Question number 48. What is the time required for sterilization of instrument inside glutaraldehyde? Glutaraldehyde 2%. Option A, 8 hours. Option B, 10 hours. Option C, 24 hours. And option D, 70 hours. For sterilization, instruments are immersed inside 2% glucaraldehyde for 10 hours, and for light level disinfection, instruments are immersed for 20 minutes. Question number 49. Chest compression ratio for an adult is? Option A, 15:2. Option B, 30:2. Option C, 30:1. And option D, 15:1. Option B is right answer. 30:2 हुन्छ compression adult मा. Children मा पनि 30:2 हुन्छ. यसमा सिंगल रेसिक्यू लगाउनु पर्छ. But infant मा 15:2 हुन्छ. Question number 50. When there is a toxicity of magnesium sulfate, which medicine is given? Option A, pralidoxime. Option B, calcium gluconate. Option C, vitamin K. And option D, protamine sulfate. Calcium gluconate हुनुपर्छ. Option B is right answer. Question number 51. A client refused medicines and the time nurse slapped the client, it is? Option A, assault. Option B, battery. Option C, negligence. Option D, malpractice. Option B, battery is right answer. Battery is touching another person in a way that is harmful or offensive. Question number 52. Which of the following is the most emergency condition? Option A, ventricular fibrillation. Option B, myocardial infarction. Option C, shock. And option D, heart attack. Emergency condition is ventricular fibrillation. It is a medical emergency condition. Option A is right answer. Question number 53. A patient with lungs problem is to be kept in a flowered positions to relieve dyspnea. Flower is? Option A, 45 degree. Option B, 90 degree. Option C, 15 degree. And option D, 30 degree. High flower positions 90 degree मा मेन्टेन गरिन्छ. फ्लावर पोजिसन 45 to 60 degree मा. सेमी फ्लावर 30 to 45 degree मा. And लो फ्लावर 50 to 30 degree मा. यहाँ only flowers position सोधिएको छ. So option A is right answer, 45 degree. Question number 54. While nurse was in a routine care, she observed redness, swelling and hot at the IV site. What can be suspected? Option A, phlebitis. Option B, infiltration. Option C, air embolism. And option D, edema. यो phlebitis condition हो. Option A is right answer. Phlebitis means inflammation of vein. Signs and symptoms of phlebitis are redness, warm, tender, pain, fever, swelling, etc. Question number 55. While collecting urine samples for culture and sensitivity test, nurse should advise patient to collect option A first urine, option B mid stream urine, option C last urine, and option D all of above. Option B is right answer. A mid-stream specimen of urine is best because the first urine may be contaminated with bacteria from the skin. So, question number 56. If the patient is not passing stool and stoma is filled with a gas and fluid, what will be appropriate nursing advice? Option A. Ambulation. Option B. Enema. Option C. Laxative. And option D. Liquid diet. Option A is right answer. Ambulation restores circulations and intestinal motility also increases. Question number 57. During tries, which of the following color indicate its life-threatening condition? Option A red, option B yellow, option C green, and option D black. Life-threatening condition red ले indicate गर्छ. Option A is right answer. Question number 58. According to the United Nations UN, youth age belongs to which age group? यहाँ age हुन्छ. Option A 15 to 30 years, option B 15 to 24 years, option C 10 to 19 years, and option D 10 to 25 years. 15 to 25 years ग्रुपलाई भनिन्छ. Question number 59. Which of the following is permanently damaged in rheumatic heart disease? Option A joint, option B heart valve, option C blood, and option D brain. Rheumatic heart disease is a condition of permanent damage of the heart valves. It is caused by rheumatic fever, which is a complications of an untreated bacterial infection with group A beta hemolytic streptococcus. Option B is right answer. Question number 60. The clinical features like the Vestibulocochlear, moon shape, and weight gain are seen in option A Addison disease, option B Cushing syndrome, option C Graves disease, and option D marasmus. Cushing syndrome में cortisol hormone को level high भएको हुन्छ र यसको sign symptoms में जस्तै thinning of hair, red cheeks, Vestibulocochlear, moon face, supraclavicular fat pad, increase the body and facial hair, weight gain, slow wound healing, thin skin and subcutaneous tissue, thin extremities with muscle atrophy, pendulous abdomen. The सबै symptoms of Cushing syndrome हो. Option B is right answer. Question number 61. A patient is in a post-operative ward. As a nurse, what does your advice for lung exercise? Option A spirometry, option B deep breathing and coughing, option C postural drainage, and option D all of above. The right answer is option D, all of above. Respiratory exercise prevents atelectasis and respiratory infection is a post-operative patient. Question number 62. A patient is medical ward, is under TB isoniazide. Doctor prescribe pyriodoxine along with these medications to prevent option A headache, option B peripheral nephritis, option C vomiting, and option D hearing loss. The right answer is option B, is a peripheral nephritis. Question number 63. A client has a massive proteinuria, hypoalbuminemia, and edema. It is associated with option A acute nephritis, option B chronic nephritis, option C nephrotic syndrome, and option D glomerulonephritis. The right answer is option C, nephrotic syndrome. Nephrotic syndrome is characterized by large amount of proteinuria, hypoalbuminuria, hypolipidemia, and edema. Question number 64. A client has nephrectomy. What is the immediate complication? Option A, hemorrhage. Option B, respiratory alkalosis. Option C, hyperkalemia, and option D, hypokalemia. The right answer is option A, hemorrhage. Question number 65. For which type of diabetes insulin is always indicated? Option A, type 1 diabetes. Option B, type 2 diabetes. Option C, gestational diabetes, and option D, all of above. Your type 1 diabetes हो. Question number 66. Symptoms like fever, chills, and musculature pain is seen in patient with option A, pertussis, option B, UTI, option C, fever, and option D, influenza. The right answer is option D, influenza. Influenza is a viral infection that attack respiratory syndrome, nose, throat, and lungs मा चाहिँ खास गरी हुन्छ र यसको सिम्पटम्सहरुमा फिभर, एचिङ मसल्स, चिल्स, विकनेसहरु आउँछ. Question number 67. After the cardiac catheterizations, where the femoral artery is used as the SS level, the nurse should option A, check the petal pulse in operative leg. Option B, check for bleeding. Option C, explain the need to flex and extend the leg. Option D, tell the client to refrain from drinking liquid. The right answer is option B, check for bleeding. यहाँ option B हुन्छ. Question number 68. Which of the following is a complication of Graves' disease? Option A, myxoedema. Option B, thyrotoxicosis. Option C, cold intolerance, and option D, peripheral. The right answer is option A, myxoedema. The pulse should be assessed because the trauma of insertion site may interfere with the blood flow distal to the site. Question number 69. यहाँ A हुन्छ. Which of the following indicate left side heart failure? Option A, ascites. Option B, hepatomegaly. Option C, dyspnea, and option D, distended jugular vein. The right answer is option C, dyspnea. Let's identify हुन्छ. It is a left side heart failure. Okay, होइन भने. Question number 70. Prolonged suctioning in a patient after tracheostomy may cause hypoxia. Suctioning should not exist beyond option A, 5 minutes, option B, 50 minutes, option C, 30 minutes, and option D, 10 minutes. The right answer is option D, 10 minutes भन्दा चाहिँ बडी गर्नु हुँदैन. if बडी गर्यो भने चाहिँ intracellular fluid loss हुन सक्छ पोटासियम. So question number 71. Hepatitis A is related to the deficiency of anti-hemophilic factor. Option A, factor 6. Option B, factor 8. Option C, factor 9. And option D, factor 11. The right answer is option C. Question number 72. If the patient can open eye with pain, his GCS scale is option A, 2. Option B, 5. Option C, 3. And option D, 4. GCS स्केल को बारेमा पनि यसको क्लास भइसकेको छ. यसको लिंक डिस्क्रिप्सन बक्समा छ. The right answer is option C, 3. Question number 73. A child gives response only after painful stimulation. It is called coma, stupor, obtundation, and alert. Option B is a stupor. Question number 74. Log roll technique is used in option A, head injury, option B, spinal cord injury, option C, fracture, and option D, pelvic injury. Option B is right answer. Spinal cord injury. Question number 75. What is the complication of over suctioning in patient with tracheostomy? Option A dyspnea, option B hypoxia, option C bleeding and option D aspiration. बडी टाइमसम्म चाहिँ सक्सन गर्यो भने चाहिँ के हुन सक्छ? हाइपोक्सिया हुन सक्छ. ऑप्शन बी इज राइट आन्सर. प्रेशर सेटिङ फर ट्र्याकियल सक्सनिङ इज 80 to 120 mm एचजी चाहिँ प्रेशर दिइन्छ सक्सन गर्दाखेरि. इट इज रिकमेन्डेड डाइट एपिसोड अफ सक्सनिङ including passage of a catheter and suctioning the tracheostomy tube is completed within 5 to 10 seconds to prevent hypoxia. So right answer option B. Remaining question set 18B ma. Thank you so much and all the best to all.